We have Seth Weil aboard with us. We are 17 minutes away from the hour of 8 o'clock. We're going to bring in Seth via Zoom. We have a very interesting discussion this morning. Seth, morning to you, man.
Good morning, Steph. Good morning. All right, so this morning, what I wanted to speak on, and it has to do with, cancer treatments. And one of the reasons why I've chosen this particular topic is I have observed that a lot of people do not understand what chemo is or what it does to the body and what radiation does to the body. Right? So many people see it as a viable option. Actually, these are the popular options with regards to cancer treatment.
Yeah.
And it's things that are pushed the most with regards to treating cancers. But when you ask somebody, do you know what chemo does to the body or how it even works? Apparently, most people have not the slightest clue. All right? So that's what I want to talk about this morning, chemo and radiation. Now, how both of them work is they work by disrupting cell division. All right? As you know, cancer has cells that are rapidly dividing uncontrollably. All right? So while cells naturally would have mechanisms to prevent them from dividing or to have them only divide to a certain extent, and then they have mechanisms in which would cause apoptosis, which is cellular death, so cell to die. So while it's dividing, other cells would die off. So you wouldn't have too much taking place. Cancer cells, these mechanisms are not functioning as they should, and these cells continue to rapidly divide. So chemo and radiation, it's designed in order to stop that division and destroy the cells. And how it does so, it's by using either strong chemicals, like in the case of chemo, or radiation through strong X-rays or photon rays in which to target areas or where the cancer is or where the cell division is taking place to destroy the DNA in the cells and then kill the cancer. All right? But the question people need to ask is, how does the body identify the cancer cells? Well, it looks for a particular trait, which is cell division, cells that are dividing fast. And as I mentioned just now, I said cells that are dividing fast, meaning it doesn't just target your cancer cells alone. It targets all cells that are fast dividing. All right? So chemo is systemic, all right? While radiation is localized, because radiation, you could target specific area, all right, where the cancer is. So chemo is systemic. In other words, it affects the entire body, all right? So it is going around your body. You added this drug either orally or intravenously into your system, and any fast dividing cells, it is going to damage, all right? Any fast dividing cells, including the cancer cells. But it's also going to damage the cells in your body that are dividing fast, that are healthy cells that are functioning how they're supposed to function. So you have cells like, for example, the fastest dividing cells in your body is bone marrow cells. Right? Your bone marrow, because it's producing blood, so you need to have those cells being able to divide fast. So damage is going to take place there. Your hair follicle cells, those cells are fast dividing. This is why your hair grows so fast, as we can observe, hair growth. All right? You have your skin cells. These are fast dividing cells, as well as, the body sheds skin on a rapid level, at a rapid pace as well, where you have dead skin and so forth. All right. You have even your gastrointestinal cells, which goes from your mouth all the way to your anus. Those are fast dividing. All right. So you have also the key one, your immune cells. Your immune cells are also fast dividing cells. Now, when you use chemo, all of these cells can be affected. All of them. When you use radiation, the cells around the area that is being targeted can be affected. And let me not say can be, is affected. All right? Now, what people have to understand that there are long-term side effects that can take place and does take place when you do these treatment options. So, for example, let's take chemo. You could have persistent fatigue, right? And debilitating tiredness taking place as a long-term side effect. So, while it can be short-term, it can also last long-term. And some changes might be permanent. You could have peripheral neuropathy, right? So this is the nerve damage, all right? Sometimes which would cause things like numbness and tingling and burning sensation, pain in the hands and feet, so forth. You could develop heart problems, all right? That can lead to hypertension, irregular heartbeats. You could have heart disease, and it could even lead to heart failure. Then you have things like infertility and early menopause. These are things that could happen. You could permanently lose your fertility. Women can enter menopause at an earlier age. All right, you have your kidneys and bladder issues, so those things can dysfunction. All right, hearing loss are things that could come about. And then we also have like secondary cancers. Right, chemotherapy can even cause you to develop other cancers. All right. You could have dental issues as well, so it could cause damage to your teeth, the enamel, the gums. So remember, all of these are dealing with parts of the body that, so even your mouth aspect is part of your digestive system. It's the entrance area, all right? You could get lung diseases as well, all right? You could get lung diseases and decreased lung capacity. You could get changes in your weight. Of course, we see all these things as well, and sexual dysfunction, all of these issues. Radiation can cause similar issues as well, and damage to your skin and lymphedema if you have to take out some of the lymphatic nodes, and even changes in breast size and appearance and firmness. You could even get organ damage based on where the radiation is taking place, based on where the cancer is and what other organs are near the radiation site. All right? So, as I'm saying here, is a lot of people don't understand the extent of the damage that can take place from this treatment, or it may not be, people may not get full disclosure as to the amount of damage that can take place when people do these treatment. And this is why I always encourage people, before you go about trying to treat things aggressively, you have to understand if it's affecting fast-growing cancer cells. And let's say you have a tumor. So you have a tumor, and the tumor is not growing. Would taking a systemic approach using chemo be the best option for you? You need to explore other options. One of the best options is nutritional therapy. Nutritional therapy. If people focus more on nutrition, because again, a lot of people are trying to get rid of cancer, which is a symptom. People need to understand that cancer is a symptom. If you don't address root cause, right, you can do all these procedures. You can spend tens of thousands, hundreds of thousands, even millions,
yeah,
and still doing all of that, throwing all of that money behind something, a treatment option, and yet still you haven't dealt with root cause. So what is going to prevent that same illness from coming back again, right? I've had people come to me, right? They had cancer. They went through those proceedings. They either did the radiation or the chemo, and now they have lifelong damage, permanent damage. Right? And guess what, Stefan? After about 8 years or so, the cancer come back. Right? After spending hundreds of thousands of dollars treating the symptom, because the root cause was never addressed,
yeah,
it came back.
Yeah.
It came back. So you're still dealing with the long-term, permanent ill effects, side effects of the treatment. And now the disease is back again. All because root cause hasn't been addressed. Now, people might say, said, why you're into holistic health, right? So you're going to be giving us the same advice as other people into holistic. There is absolutely nobody in the Caribbean that does what I do. Absolutely no one else. There's absolutely nobody else in Trinidad and Tobago that does what I do. I created a unique field, right? I created something very unique, all right? I do not push or promote the use of any drugs, supplements, herbal products, nothing. What I do is nutritional therapy. I coach people's diet, help them to understand root cause from a scientific standpoint. And I think because of the use of the term holistic, all right, I think people assume that I do the same thing as other people. When I use the term holistic, I just simply mean I deal with the entire body as one unit. Holistic health, we deal with every aspect of it, right? That's what I mean by the term. It is not the same as other organizations that uses the term holistic, all right? And I think that is something that has been confused, and people kind of, just put you in a bag with, or a bunch with other organizations, and this is why a lot of people will call me and say, oh, you're the herbalist. I am not a herbalist, and in fact, Stephan, you yourself have corrected many people when they make that statement, all right? So, and because of that, most people don't understand the importance of nutrition. You have to address root cause if you truly want to heal. You can't be trying to get rid of a disease and not address the root cause. You're going to do these procedures that have these serious side effects. No, I'm not saying not do them, no, that's your call. That's entirely an individual's call. Like I say, I force nothing down people's throat. But I've seen the medical world use the fear factor, right? Use the fear factor. So people that have tumors and the tumor not even growing in size. And they push that fear factor. If you don't do this, you're going on dead.
Yeah.
Right?
Yeah.
They push that fear factor so people could go and do these very expensive procedures because it lines their pocket with a lot of money. Right? Now, many people mightn't like to come out like how I would come out and say these things and call it out. But this is what has been going on. I did a segment, I think, about a month or two ago, where we looked at the Flexner report, and we saw how the entire medical system was corrupted because 99% of pharmaceuticals are made from petrochemicals, right? So it's a profit industry. So they push these things. That's why doctors don't have much training with regards to nutrition. So they push these things down your throat, all of which have side effects, when there are other means in which for you to get help and help you reverse your issues without having to use all these harsh methods. And I don't know when people would start to get it. Instead of being sick, cancer is the second leading cause of death globally. And it continues to be on the rise. How can we be living in a society so technologically advanced, but all health issues continue to rise? It makes no sense. And I don't know why we're still going after these things. And it could just be the laziness of the people. It's easier to take a procedure, right, that has nothing to do with you changing your lifestyle and your way of eating or anything like that, than making those dietary changes. People want to eat what they want to eat. We want to go out there and we think all life is about is enjoying food. Right? A lot of people, when they travel, they just think, let me go and try to eat this and eat that. Go and visit sites. Go and look at historical monuments and stuff. Right? Why does it always have to be just the food? Right?
Well, said all the time. But just in closing here on the point that you just made, that cancer is the second leading cause of death in the world.
Cause of death. Yeah, in the world.
It's amazing, and I've got to wrap up now, but it's amazing that is a statistic when people spend so much money for treatment. So
that's the thing.
You would think that if a treatment is going to cost you over a period of time $100,000, $200,000, $300,000, that it would be working, and that cancer would be probably the 10th leading cause of death in the world globally because of the kind of money that people spend for these treatments, right? So the fact that you spend this kind of money for that type of treatment, for that disease, and it's the second leading cause of death, I mean, it just speaks to I guess the questions that one should be asking in terms of the medical fraternity. I mean, if this is not effective in a way to bring cancer from the second most leading cause of death down the ladder to like the 10th or the 12th or whatever, until it isn't a cause of death, then why are these treatments so expensive?
Yeah, and if you look at some of the most deadly cancers and you look at survival rates, all right, they'll tell you it have high survival rate, these treatment methods, but it always within over the next pass or the next 5 years, all right? But if you go, let's say, survival rate for 10 years, you're going to see that survival rate dramatically drop.
Okay.
Dramatically drop, because a lot of the times, the long-term side effects from the treatment, that can definitely shorten your lifespan. Right? So these are things that people need to understand and take a look at. And then you must go for root cause. Nutritional therapy is the way to go. You have to fix your diet. Have to fix it.
All right. So I'll tell you what, people, you can contact Seth on 7611952. That is 7611952. Or you could WhatsApp him on 2793935. We're going to take a break. Thanks a lot, Seth. And
thanks for having
until
me.
next week, man.
All right, then next week.
Yeah, man.